In a concentric mode, you can keep challenging that muscle without that muscle soreness. You're not going to get that muscle inflammation, that muscle breakdown. So every day you can push harder without being sore. And so that soreness, like if you're an in-season athlete and you're playing basketball, you can't risk being sore the day of the game. So you don't train the day before, right? So if you work out at a load where you're not challenging the muscle eccentrically, you're probably not doing too much for it. Concentric also allows you to train at high velocities without risk of injuring the muscle tendon unit or the ligament. So the concentric load allows you to train at much higher velocities. And so when you're training concentrically, you're really training muscle fiber, you're training your neural pathway. That's why we think it's so effective in neurologic disease. It happens in very rapid, like sporting events. And so your brain has to connect to the muscle groups, instruct the muscle groups to fire. It has to be coordinated and synergistic. And so if you train at high speeds with concentric loads and use major muscle groups in complex movements, you're training the neural pathway also. And it also allows you to do aerobic training. You can do aerobic training with eccentric also, but eccentric ballistics are risky from a safety standpoint. Eccentric or concentric ballistics are not unsafe. And so it allows you to get your heart rate up. It allows you to have a resistance exercise and an aerobic exercise simultaneously, which is a major benefit.